I'm JJ Virgin, PhD dropout, sorry mom, turned 4-time New York Times bestselling author. Yes, I'm a certified nutrition specialist, fitness Hall of Famer, and I speak at health conferences and trainings around the globe. But I'm driven by my insatiable curiosity and love of science to keep asking questions, digging for answers, and sharing the information I uncover with as many people as I can. And that's why I created the Well Beyond 40 podcast, to synthesize and simplify the science of health into actionable strategies to help you thrive. In each episode, we'll talk about what's working in the world of wellness, from personalized nutrition and healing your metabolism to healthy aging and prescriptive fitness. Join me on the journey to better health so you can love how you look and feel right now and have the energy to play full out at 100. Still remember one of the first signs that I was going into perimenopause. I didn't know what it was. I didn't know that this was a sign. I started getting these bleeding gums. I went to my dentist. I go, what the heck is going on? Am I flossing too hard? He goes, no, your hormones are dropping. It's like, what? I've now decided I've coined this menopause mouth, and I actually have an expert in menopause mouth and an expert in mouth detoxification. I have the amazing Dr. Sanda Moldovan with me today, and we are going to be talking about all things dentistry and signs and symptoms that you can see in your mouth that can be indicators for issues with heart disease, could be why you have chronic fatigue, can tell you early about osteoporosis, all sorts of stuff that you can find out. Dr. Sanda is recognized internationally for her expertise in oral health, nutrition, and anti-aging. She is board certified in 2 areas, both periodontics and nutrition. I've never heard of that. A periodontist who is also boarded in nutrition. How uncool is that? And because of that, she put those 2 together, and she has this really cool approach to biological dentistry. And you're going to learn what biological dentistry is. Once you hear what it is, you will never want to go back to a conventional dentist. She's the published author of Heal Up, 7 Ways to Faster Healing and Optimal Health. She's a speaker. She's been on all sorts of TV shows. And she is a fantastic speaker, by the way. I'll see if I can get a cut from the talk she did at our event to link to, because it was fantastic. She showed some crazy pictures. She also has developed her own line of natural oral healthcare products called Orasana. I'm going to put all of the information plus an ebook on how to detoxify your mouth at jjvirgin.com/mouth detox. And I will be right back with Dr. Sanda Moldovan. Prepare to have your mind blown. All right, Dr. Sanda Moldovan, welcome to the show.
Thank you for having me, JJ.
I'm very excited to talk about this because I don't think I've ever talked about what I'm going to call menopause mouth on the show. And I'll just give you a little entry into this. I still remember this was probably 15 years ago, going over to my dentist in Palm Desert and going, my gums are bleeding. What the heck? Nothing's changed. He goes, oh, yes, something's changed.
That's right. Yeah, the hormones changed.
Hormones changed. So, we think about aging and we think about our body and our skin, but what goes on in the mouth?
What a lot of people don't know is that we actually have estrogen receptors in the gums. So for that reason, anytime, as women, we experience hormonal changes, whether it's menopause, pregnancy, puberty, anytime gums will react because the mouth is the gateway to one's health. So we see that. But in menopause, what actually happens, gums actually become more frail. And the top 3 things that menopause mouth causes is basically a dry mouth, increase in gum disease, and the third thing, which is unusual, is burning mouth syndrome. And women will experience this sensations like the gums are burning, and it's really related to hormonal changes. And about 15% of women actually experience this.
Wow. I just had the bleeding ones. I'm glad I did not have the burning ones.
Yeah. It's unpleasant. You feel like you have fire on your gums, and there's not much we can do about it from a topical perspective. I basically refer patients to get hormonal replacement therapy to help them balance out the hormones.
That leads me to think then, this was one of actually the first signs that I was in perimenopause. was bleeding gums. And I just wonder what else, as you start to do an oral exam, can you find out from an oral exam? What other health conditions besides like your estrogens going down?
What's interesting is we can look at the salivary glands, which are on the side of the cheek and also underneath the tongue. And we can actually express saliva. And what we see in about a third of the women experiencing menopause is that there's not enough salivary production. We call it xerostomia or dry mouth. And that can be pretty uncomfortable. I have women, unfortunately, that are talking and their lips get stuck to their teeth because they don't have enough lubrication. It's very uncomfortable.
Wow. And same thing, they go and get hormones replaced and then everything's cool.
I wish it was that easy with salivary glands. With saliva, it's a little more difficult. So my recommendation is for people that are suffering with dry mouth is to try to stimulate that gland. It's kind of like working out, right? We exercise the muscle in order to keep it active. Same with saliva. We want to exercise those salivary glands and those muscles that are pumping saliva. So how do we do that? Sugar-free lozenges to stimulate that salivary flow. Sometimes even like a more sour taste, get that saliva flow in the mouth. Also, we can stimulate it via red light therapy, which is another natural approach. As a biological dentist, I always try to recommend natural things. The red light therapy seems to help, especially when placed on the side of the cheeks where the major salivary glands are present.
So with red light therapy, and I want to get into biological dentistry in a second here, but with red light therapy, do you just stand in front of the red light or do you have to open your mouth? Like, how does it work? Do you have to go in your mouth with it or what?
Hey, the good news is you don't have to go in the mouth. There's actually these round heads of red light. You could just put it on the side of the cheek. It's about the size of your palm. And you put it in contact with the skin and you just leave it there for about 20 minutes. You can feel a little bit of warmth. I know some patients have said, I bought this light, but I don't feel warmth. I'm not sure that is strong enough. There's so many red lights on the market. So find one that actually, is a reputable company and it creates enough warmth because you want it to penetrate through the skin. The salivary gland is literally from the outside of the skin is within like a centimeter. So you will get that red light therapy without having to go in the mouth.
And it's good for your skin too.
Oh, exactly. You get
a bonus point.
Yeah.
So you kind of threw out there, I'm a biological dentist. I don't think people know that there's such a thing or what that is. So can you discuss what a biological dentist versus a conventional dentist is? I kind of liken it to functional medicine and allopathic medicine.
That's basically the big difference right there. Traditional dentistry, a lot of people listening know, is basically drill and fill. Oh, you see a hole in the tooth? Let's fill it. But in biological dentistry, we treat the whole, not the whole, I like to say.
Ha ha ha.
So we want to look at the mouth as a potential source of infection because of things that are reintroduced in it. So we want to detoxify the mouth for a healthier body. Anything that happens in the mouth, like infections or cavities, why is it happening? We really go to the root cause. And then we also find solutions that are personalized to each individual based on their genetics by doing blood tests for different materials, dental materials, to make sure what we put in the mouth is not going to cause an immune reaction.
Shouldn't that be standard?
I agree with you. And that's my mission, to really make this biological dentistry as a standard, because it isn't. And
that's wild.
Yeah.
What would happen if someone put in some type of a filler for a crown or something and it caused an immune reaction?
What we see is itching at the gum line. So people say, this actually itches. Or, what I've seen with veneers, especially, people put these beautiful veneers on their teeth, but then the gum line is red and inflamed. And that actually could be an allergic reaction from the cement that was used.
Wow. So how would someone know, how do you find a biological dentist? Are they listed as such? How would you know to find one?
The best way to find a biological dentist in your area is IAOMT, which is the International Association of Oral Medicine and Toxicology, IAOMT.org. And they have a directory of biological dentists that are trained as mercury removal certified, and they're certified in certain things to create the biological experience.
Well, let's dig into that since you mentioned mercury. And, I just think back to when I was a kid going into the dentist. And first of all, I had orthodontia. So I had all that horrible stuff all over my teeth. But then getting those silver fillings, which I then had removed. But the person who removed them did not do them correctly either. So are those things still being used in conventional dentistry? And what do we need to? That's a big, long question. Like, what do we do about things like mercury fillings? And if you're going to a conventional dentist, are they still using some of these toxic materials?
Yes. Unfortunately, in United States, mercury fillings are still legal and they're being placed, especially in children.
Wow.
Yes. In a lot of the countries in Europe, they've been banned. But in the United States, it's a political issue with the ADA because they don't want to get sued now from everybody that's become toxic. But studies have shown that we insert a mercury filling, which is basically anybody who's looking in their mouth and they see silver fillings on their teeth, those can be up to 50% mercury. And the reason why they were labeled silver filling, because silver sounds a lot better than mercury,
Yeah.
but they're not silver at all. They're just the
Wow.
color silver. We know that in sheep, studies that were done, you put mercury fillings within a month, that mercury has ended up in the liver, in the kidneys, in the lungs, and in the brain of the sheep. And the same thing applies to humans. I myself had a story just like you. I grew up in Romania. I had 16 large mercury fillings in my mouth growing up, and it made me very toxic.
So what did that look like? How did you know? And what did you do about it?
I remember at the age of 14, when I immigrated to the United States with my family, I was starting to not feel well. Literally, when you looked in the back of my mouth, my teeth were all black. And it wasn't until I went to dental school that I'm like, oh, maybe I should change these. But I didn't know anything about biological dentistry at the time. So I had them removed unsafely, just like you. Then I started developing headaches because what happened during the process of removal, as we're cutting into the mercury fillings, the vapors are very toxic. And as biological dentists, we protect patients when we remove these fillings. But in dental school, unfortunately, it is not taught. So when we cut into these mercury fillings, not only you as a patient get intoxicated, but the dentist, everybody gets intoxicated. And the levels of mercury vapors coming off the fillings is 2,000 times more than the EPA allows in the atmosphere. So it's pretty toxic.
And yeah, I was just thinking about okay, so you do this to a patient, but the dentist is exposed day after day after day as well. And how would someone know that this is a problem for them? What symptoms and what tests, and then what do they do?
What I was experiencing is headaches, chronic fatigue, really neurological issues. And I didn't attribute it to the mercury removal until I actually found a naturopath who did a mercury test. And that's what a lot of people experience, like chronic fatigue, headaches, blurry vision even associated with mercury toxicity. The best way to test for mercury is really through a urine challenge test because mercury doesn't sit in the blood. People say, oh, I tested my blood and my mercury was fine. Yeah. Well, no, your body's smart enough not to keep the mercury in the blood to become toxic. So it stores it in the fatty tissues.
Yeah. So, and when you said a challenge, that means that you have to challenge it with some kind of chelating agent so that you can see how much is coming out. Because your body, again, bodies store things so that you're protected. Unfortunately, when it does that, it does a whole host of other things. I remember hearing that the data from the N. Haynes study was showing that, everyone thinks that people who are obese have a higher risk of diabetes, but it wasn't because of the fat. It was because of all the toxins stored in the fat that were causing the insulin issues.
That's right. And a lot of people that can't lose weight readily is because the body's not ready to let go of all these toxins that are in the fatty tissues and they need some support.
Yeah, I'm glad you brought that up because one of the things I'm putting together with my next book is that you should not be on a fat loss program unless your body's able to detoxify well because you'll free up the toxins. And if you don't, then this is why these juice cleanses make me crazy. because it's an amino acid dependent step to
Why?
neutralize the toxins that you freed up. And so
Yeah.
you do juice cleanses, you just create a big problem for yourself.
Yeah. Like I remember how sick I felt. Like I started doing some chelation afterwards, and the IV chelation, releasing the mercury in the bloodstream. Wow. I had to really it made me dizzy. I had to lay down. It's just not pleasant.
So when you see this now with patients, because I know you work a lot with detoxification, what are you doing to help support them and what do you recommend for? Because I think a lot of people have gone through this and been
Yes.
subjected to silver fillings, right? So,
Silver fillings. Silver fillings. Very, very important to support in this detoxification process when we detoxify the mouth. Because as we mentioned, not everybody's ready for detoxification. So number one, before we start removing mercury from the mouth, we want to know how toxic someone is. So I work with a lot of integrative physicians and practitioners, naturopaths, to help support the patient from a body perspective. And I like to use oral chelation, especially initially for patients right after mercury safe removal. And there's tablets essentially that have chlorophyll in them and cracked chlorella that really helps to bind the mercury particles that may have been in the area to take them out through the GI tract elimination.
When I think about other things going on with menopause, there's two other things that I really think about that I know there's a mouth connection. One, of course, is osteoporosis. Can you see anything happening in the mouth with that? What's the connection between bone health and the mouth?
Great question. I always look at the mouth as a window into one's health. And as menopause sets in and dry mouth sets in, not only osteoporosis can join in that, but also the teeth become more brittle because teeth are bone. They're the same kind of matter. So when we see teeth disintegrating, we know bones are also disintegrating in the body. And how do teeth disintegrate? Well, some of you might already have had these experiences listening, basically teeth chipping. You look at your front teeth and you start to see, oh my God, I'm getting serration, like little ledges, and I chipped the front tooth and now I chipped the tooth over here because saliva is there to mineralize teeth. That's why saliva is so important. When saliva is not present, the teeth become more brittle and they start to break down. Maybe more of those, we call them craze lines, but little like fracture lines that are vertical that show up on the teeth. And teeth become more sensitive. Sensitivity to temperature is a sign that the teeth are getting more brittle.
The other one of those is heart health. And I remember reading something about mouth bacteria and heart disease risk.
Yeah. Periodontitis, which actually goes up, or gum disease, as the mouth gets drier, there's more plaque growing in the mouth. That bacteria, whenever gums bleed, and you mentioned, you started experiencing bleeding gums, bacteria has a chance to catch a ride in the blood vessel and it starts to travel. Our immune system, unfortunately, is not perfect. It can't see every bacteria every time, especially the ones that are, we call them stealth microorganisms that kind of encapsulate themselves and they almost become invisible to our immune system. And we know that certain bacteria that causes gum disease ends up lodged in heart valves. And people with gum disease have up to 3 times more risk of heart attacks because of that reason.
Wow. So how would someone know if this was an issue?
You would know if it's an issue if you actually look in the mirror. And I highly recommend everyone listening to pay attention to the gums, look in the mouth, do a self-exam. Even though you think the mouth is not such a fun place to look at, but I highly recommend you look at your gums, see if they're swollen. Do your gums bleed when you're brushing? Especially for those people that don't like to floss, that's when gum disease starts to set into place. So when you see the gums bleeding, that's an opportunity to improve it. I think everyone listening can do this at home. They can just brush, water floss, and use a chewable probiotic. Those are my recommendation for the 3 steps to optimum oral health at home to reduce the amount of bleeding. Because even if you go to the dentist and they do some deep cleaning or treatment for you, if you don't do the brush floss probiotic at home, it's not going to hold and you're going to continue to have bleeding gums.
Okay, hold on. We're going to this 3-step process. We're definitely going to hit it. Before we get to that, because I have some questions around mouthwash and fluoride and all of that, jaw cavitations.
A lot of people don't know what those are.
No, I didn't. I was just Googling it right now going, what is that?
Just as a cavity is in a tooth, a cavitation is a hole in the jawbone. Well, how does a hole end up in the jawbone? When we have a tooth removed, for example, or maybe a root canal, there's a chance for bacteria to go either straight into the bone or, in case of a root canal, through the tooth into the jawbone. And it starts to form a home there. And this hole becomes bigger as the bacteria releases acids and it causes bone loss. And a lot of bacteria that cause jaw cavitations don't need oxygen to survive. So they'll continue to live there. And that's something that I do as a biological dentist, identify cavitations. Why? Because it makes people sick. It can cause inflammation in the body, brain fog, chronic fatigue. It puts a burden on the immune system. So my job is to remove all the microorganisms that live in the jawbone to allow the body to heal.
How do you find them?
A cone beam CT scan is what I use to find this. And I think this is a standard for us now in biological dentistry to have a cone beam CT scan. What it is 3-dimensional x-rays. Why? Because the 2-dimensional x-rays, we really don't see much. We see maybe from the studies that we have about 50% of the problems. And I have patients that are like, I've been to the dentist, I have this pain, nobody can figure out what it is. And I'm their 3rd or 4th consultation, taking finally a 3-dimensional x-ray so I can see what's going on.
Wow. So that's not standard of care in most dentists.
It's not. I want to say maybe up to 20% of all dentists today have 3D x-rays in their office, but it's not common yet. But I do expect it to be the standard of care for us. It is in our practice already. Anybody coming in that's either had teeth removed, such as wisdom teeth or root canals, will get a cone beam CT scan so we could see inside the bone.
I remember you mentioning this because I then started searching to find someone that did this in my area and could not, because you had a different way of doing exams and cleanings. Now, I don't remember what it was. I just remember I couldn't find it. I'm like, come to your office.
Definitely. We call it like a full mouth detoxification because, the mouth is the opening of the GI tract and it holds a lot of bacteria, could be good or bad. If its gums are bleeding, bad breath, we know it's not so good. We do a saliva test as somebody enters our practice and see, okay, what kind of bacterial fingerprint is in the saliva. We identify the bad bacteria and then we do a full mouth detoxification where we cleaned not just the gums. A lot of you maybe that had these gum bleedings, they say, oh, let's do a deep cleaning. That's what most dentists do. And they only scrape around the teeth that are a problem. But 60% of the bacteria in the mouth is on the tongue. So we actually clean the tongue using, it's like a pressure washer with erythritol, which is a sweetener. And erythritol is antibacterial. That's why we use that. And it really wipes off the entire biofilm from the teeth, the gums, the cheeks, the tongue, underneath the tongue. So we can really start fresh.
Wow. It's just wild. Like none of this stuff I've ever heard. I've been religiously going to the dentist forever. And,
the company that offers this has a technology called Airflow. And it's Swiss. It's a Swiss technology. They've been around for over 20 years. And unfortunately, it's not common in the United States to use it. But I would say in Europe is more common. But still, I think we have to start looking at the mouth as a whole, at the body as a whole, not just at the teeth and the pockets.
You need to start open centers. One in Tampa, quickly, please.
Yeah.
I know last time I talked to him, I've got to get over to your office. And literally I went and started to try to find someone. And I now have that IAOMT.org, but still they're not doing, what you're doing is so cutting edge. It's incredible. Now, someone comes into your office and they go through this, and I love the full mouth detox. What are they doing at home then? Because you look at what normally happens at an office. First, they try to give you fluoride treatment. I'd love your opinion on that. And then they send you home with Crest and a toothbrush and some floss.
Oh my gosh, yeah. I just did a podcast on flossing, actually. It turns out string floss is not as effective as a water flosser.
How do you use a water flosser without also getting a facial? Or is it just me? And dousing the mirror. I'm like,
I have two great tips for that. One,
maybe you need to do a YouTube video on that.
Yeah. If you use actually a washcloth as you're using it, using in one hand, you hold the other washcloth like that. It'll actually hold the water, or just close your lips around it and let the water just trickle out of one corner of the mouth.
Okay.
But very important, I think the recommendation is really brushing without fluoride. Okay. We don't need fluoride, especially there's no studies that fluoride actually helps as adults at all.
How did fluoride get to be such a thing? Like every time they ask me, I'm like, no, I do not want that. But how did this happen where they're even putting it in the water?
Fluoride was an agricultural byproduct. And sadly, they didn't know what to do with it. And they said, oh, well, let's dump it in the water at 1 parts per million because, it might help with cavities. So that's how fluoride ended up in the water.
Wow.
Exactly. There's a great documentary called Fluoride Gate, which I like for people to watch just to get educated. European countries have banned fluoride. A lot of them have. And there's much better products out there. Our recommendation is calcium hydroxyapatite, which actually mineralizes teeth. It's the same mineral that the teeth are made out of. And we know that it gets absorbed in teeth, especially in women that have dry mouth. Calcium hydroxyapatite is so important to help with the tooth mineralization.
So is that something that you're taking as a supplement, or you're using as a toothpaste? What are you doing with it?
Yeah, as a topical. There's toothpaste and tooth powders out there with calcium hydroxyapatite. That's what I recommend, not fluoride. It really helps to maintain the enamel strong.
Nice. All right. So someone goes home now. What are they doing at home?
What they're doing at home is brushing manually with a tooth powder.
So not one of those sonar things?
If you like a Sonicare, by all means, or like an ultrasonic brush is fine, especially people that have poor dexterity. Totally fine. You have to be careful. If you have thinning gums, you're starting to experience gum recession. Do not use one of those Oral-B rotary brushes because it will cause more recession. So I like a fine bristled toothbrush, small circles, or some fine bristled sonic brush. That's okay. But hydroxyapatite tooth powder, I developed my own formula for mineralizing tooth powder with probiotics. I'm a big fan of probiotics, especially topical, because of the anti-inflammatory effect.
We'll definitely link to your store,
Absolutely.
which I'm going to go shop at right after this. Okay, fine toothbrush and hydroxyapatite tooth powder. And then
step 2, using a water flosser with the little fine bristles to actually help people guide along the gum.
Which water flosser do you like?
I have a design that I created myself. It's a portable one because I'm on the road quite a bit, so I wanted something portable. And it has 3 tips in it, 3 tips attachments. One for deeper areas in the back, one like little tufts, and another is a tongue scraper. It is important for people to use a tongue scraper to clean the tongue, especially if you see that whitish coating on the tongue, because it does get accumulation of dead cells.
Do you do that every time you brush or once a day? How often do you need to do the water flosser and the tongue scraper?
The tongue scraper, I would say, depending on the diet, if somebody has a nice amount of fiber in their diet, a lot of fresh vegetables, then you can look at the tongue. The tongue will actually be cleaner. Very important because fiber helps also to clean the mouth from plaque. If you look at the tongue and you see developing a coat, you can definitely scrape it every day. I only do it twice a week, but I also have a good amount of fiber in my diet.
Okay. And the other thing you said were probiotics.
Probiotics. So the studies today on chewable probiotics are pretty incredible as an adjunct to keeping our mouth healthy. They're not going to work if you don't brush and floss, but they work great. I get that question. Can I just pop a pill and have it do the brushing for me? It doesn't work.
Although someone did send me this thing that foams up in your mouth to act like toothpaste that you're supposed to then use with a toothbrush, I think. It's not your Dutch. You're supposed to use it as a pill.
Did you like it?
Yeah.
Yeah, it's actually a toothpaste tablet. And yeah,
Is that yours?
It's not mine, but I think it's a good idea. It also, some of them do have the calcium hydroxy in it.
And is there any reason to use a tooth powder versus a toothpaste?
Toothpaste oftentimes have a lot of additives, and I like my products as clean as possible for that reason.
What would be the scary additives that people want to avoid? And also, along those lines, the issue with mouthwash, from what I've heard, in microbiome. Those two questions.
Yeah, exactly. So glycerin, for example, it's in a lot of the toothpaste. There's also, sodium lauryl sulfate, which is a surfactant to create that foaming effect. Actually, SLS can be an inflammatory agent for a lot of people. So I don't recommend it. Gluten is one that's used in toothpaste.
What?
Yes, to give it a thickening effect. You know the polishing paste when you go to the dentist, and that also has gluten in it.
Whoa.
So we don't use that as well, that little sand things. And you know what's interesting? If you actually ask your hygienist what's in this, they would have no idea.
Wow. People just get so used to doing things the way they've always done things, they don't question it.
That's right.
Versus it looks like you've questioned every single thing. And it also seems like a huge unfair advantage to have the European connection and know what's being done over there. And it's obscene to me that they've stopped all of these things in Europe. And I mean, I know it's the same with GMO foods, and yet here we are.
Yeah.
There's stuff going on. And speaking of foods, so you mentioned fiber. Anything else that are things that we'd want to look at for eating to have better teeth, better oral health?
Anything with minerals, I think it's great. So I like things like dark leafy greens. They have a good amount of mineral. Why? Because everything we eat comes out through saliva. I want to make that connection for people. Whatever you eat, the minerals in your diet will come out through saliva to mineralize the teeth. So if you're not getting enough minerals, and you don't necessarily have to do dairy to get minerals, because a lot of people say, oh, I'm just going to drink more milk and that's going to be good for my teeth. Well, right. Well, that's not the case. You can actually do dark leafy greens. There's a lot of minerals that you can find there. You can do it in a powder, a protein shake. You can cook them. You can take supplementation, calcium, magnesium, phosphorus. These three ingredients, I think, are so important to mineralize the teeth and the bones from within. Research by Weston Price back in the 1930s actually showed how important, these nutrients are to the body and to nourish the teeth.
Yeah, I remember seeing pictures from Weston Price Foundation of people on different diets and just how their teeth and their jaws and everything looked. And it was like crazy.
Yes.
Crazy difference.
For menopause mouth, highly recommend to increase the level of antioxidants, because as we get the gum inflammation that causes oxidative stress, it is important to increase antioxidant level, including omega-3 fatty acids. There's been an association between an increase in omega-3 fatty acids. So you can also eat that, like basically fish, like salmon has nice fat level to help with omega-3 intake.
And would you recommend people also supplement with fish oil and minerals, or do you think they can get enough from their diet, or do they need more?
I do recommend omega-3 supplementation, especially for people that have gum disease, like 2 grams a day. I think we cannot eat that much fish.
And I mean, then we have to make sure our fish is clean. So there's that issue.
There's that issue nowadays.
So shop Vital Choice, but you're not eating fish every day. I think we get it like 3 times a week. So we take our fish oil too. So there's so much here. And I know we're going to link to, you have an ebook about, what's the ebook that we're going to link to? It's, I think, Detoxify
your mouth. Yes. I call it the real secret to health and longevity, because it is a secret.
It is a secret. All of this is a secret. Why is this a secret? You must get out more. Like you have to. You need to create, like, we need you all over. Although I'm going to get my mouth over to Beverly Hills. But this has to be out there. It's amazing how much this information's not out. It's crazy.
Yeah. I'm making a mission to get it out there for sure.
Good. I'm glad that you are. I'm going to help. So we'll put your free ebook on that. Also a link to your store and a link to your podcast and soon to be YouTube channel, which I'm super excited about. And one of the things for everyone listening, Dr. Sanda did a talk at our Mindshare Summit, and I was standing backstage and all I could hear was, ew, showing some of the things that you can find when you are a biological dentist working in the jaw. What were the pictures you were showing?
I had this young patient in her late 20s that had actually parasites in the jawbone. So when I opened it up, my camera is always right there. I'm like, oh, we need to film this. She was chronically fatigued, couldn't hold a job for 2 years, and she did everything else right, ozone IVs. And finally, we addressed the mouth, and basically she was able to heal after we took out all this parasitic infection. I actually have that video on my YouTube channel.
Wow. So, I mean, I think this is really important, especially if you've been battling any of these things and gone to doctors and you haven't addressed this. And I also think just like we search out the functional medicine doctors and the holistic integrative, same with for your mouth, this is where you need to be. So we'll also link up to how to find a biological dentist. And if you happen to be anywhere near Beverly Hills, then seek out Dr. Sanda Moldovan. And thank you so much. I'm going to put all of this at jjvirgin.com/mouth detox.
Right. I like it.
Easy to remember because that's what you're going to be out teaching everyone about. And thank you so much for coming in and talking menopause mouth with me.
It's my pleasure. Thank you for having me.
Be sure to join me next time for more tools, tips, and techniques you can incorporate into everyday life to ensure you look and feel great, and more importantly, that you're built to last. And check me out on Instagram, Facebook, YouTube, and my website, jjvirgin.com. And make sure to follow my podcast so you don't miss a single episode at subscribetojj.com. See you next time.